Welcome to the Recovery Room. I'm cancer physical therapy specialist, Dr. Leslie Walke. Let's talk palliative care. Now, would you be surprised if I said palliative care has pretty much nothing to do with death or dying? Probably you would, as it is common for the general public and patients and even healthcare providers to confuse the terms palliative care and hospice care. And though they do have some commonalities, palliative care and hospice care are two separate aspects of healthcare with different scopes and different goals. Hospice care specializes in caring for people in the last phase of their life, typically the last 6 months. The goal here is to provide care to improve comfort and quality of life. In hospice care, treatments and medications can be used to do things like reduce pain, make people safer, make them sleep better, treat infections, or make it easier to breathe. In hospice care, treatments are not used to attempt a cure or to extend life, but they solely focus on symptoms and quality of life. Here is how palliative care differs. Palliative care is care given to improve the quality of life of patients who have a serious or life-threatening disease, but without the requirement of impending death. So basically, they take care of the side effects and symptoms of people who are really sick now but are expected to recover, or people that are really sick now and may die eventually, but they are expected to live for years yet. According to the National Cancer Institute, the goal of palliative care is to prevent or treat as early as possible the symptoms of a disease, side effects caused by treatment of a disease, and psychological, social, and spiritual problems related to a disease or its treatment. A palliative care team may include professionals like physicians, nurses, social workers, physical therapists, chaplains, pharmacists, dietitians, and psychologists, etc. So in the case of cancer, a palliative care team would work alongside a cancer team. The cancer team works to cure or minimize the cancer, while the palliative care team works to treat the symptoms of either the cancer or cancer treatment. So things like constipation, diarrhea, fatigue, nausea, pain, etc. So curative treatment of surgery, chemo, and radiation happens simultaneously with palliative care's symptom management care. Now, depending on where you live or how big or how rural your cancer center is, you may or may not have access to a palliative care team. If your cancer center does have one, you can ask to be referred to the palliative care team at any phase of your treatment or recovery. For the majority of you cancer patients and survivors who don't have access to a palliative care team or physician, there are still options. Number one, clearly communicate your symptoms with your cancer care team doctor or nurse. Being stoic and putting on a brave, positive face during your doctor visits isn't always the best thing for you. Telling your team about your symptoms is not complaining. It's telling your team about your symptoms. Remember, your cancer team can't help the symptoms that they don't know about. Number two, if you feel like you are not being heard or don't have time to convey your concerns, contact your doctor or nurse either before or after your visit by phone, email, or through your system's MyChart to seek answers. You can also always talk with your primary care physician or nurse as well. And of course, you can also ask to talk to a pharmacist, dietitian, social worker, counselor, etc. If you are in a rural area or go to a smaller cancer center that doesn't have these services, look into the option of a televisit at a larger institution. And four, if you don't already have one, please ask to be referred to a physical therapist to help you with any mobility, pain, fatigue, or weakness concerns. And number five, if you are struggling with sleep, fatigue, swelling, neuropathy, pain, please check out the Recovery Room's video playlists on pain, fatigue, exercise, etc. to learn more about how you can help yourself with some of these symptoms. If you haven't already, please follow and like the Recovery Room on both Facebook and YouTube, and please share our videos with others. I'm Dr. Leslie Walke signing out from the Recovery Room. Please care for yourself as if you are the most important person on this planet, because you are. Let's talk again soon.